Guys, all ready to go? There are 19,615 confirmed cases of coronavirus in total since the beginning of the pandemic in Victoria. That's an increase of 55 since yesterday's report. There have, I'm sad to say, been 683 Victorians who have lost their life due to this global pandemic. That's an increase of 8 since yesterday's report. 2 males in their 60s, 2 males in their 80s. 1 female and 3 males in their 90s. We of course send our condolences, our sympathies and best wishes to each of those 8 families. 6 of those 8 deaths are linked to aged care outbreaks. There are 238 Victorians in hospital, 22 of those are receiving intensive care and 13 of those 22 are on a ventilator. A total of 2,412,092 test results have been received, which is an increase of 8,704 since yesterday. Just if I can pause on that for one moment, that is less tests than we would like, but we will see, I think, in coming weeks and months, with so little flu, so little cold symptoms, we will see less symptomatic people in the community in general. How that should be heard, how that should be, what that should basically motivate is anybody with even the mildest symptoms, because cold and flu is so low, if you have even mild symptoms, the chances of you having this coronavirus are that much higher. That's why it's so important that every single Victorian who has even the mildest symptoms, as soon as those symptoms begin, please come forward, please visit one of the more than 190 test sites across the state. Please get tested and isolated home until you get your result. Those results are coming through, the vast majority now within 24 hours, because of course volumes are down and the number of positives. Every one of them is critically important. It's that sort of intelligence, that data, that allows us to have the best public health response and the greatest certainty about how much virus is out there in the Victorian community. Can I give a shout out to the Apollo Bay community, where many people came forward for testing following the sewerage surveillance, the fact that virus was found through that process. We're very grateful to each of them who've come forward and got tested. Again, there's everything across the board in terms of following rules, looking out for each other. It's all very important, but arguably the most important contribution that you can make is if you've got symptoms, even the mildest symptoms, to come forward and get tested. It's a simple thing, but a really powerful thing that you at a personal level can do to get us all out of these rules and to a COVID normal sooner than would otherwise be the case. There are 4,344 cases of unknown source. That's a decrease of 25 since yesterday's report. There are 260 healthcare workers who are active cases, and we again wish them well and thank them for the amazing job they're doing in health and aged care services right across the board. They really are doing the best of work, and we send our best wishes to them, those who have contracted the virus. There are 1,696 active cases in Victoria, so that number continues to steadily fall. In terms of the regional metro breakdown, I'm very pleased to be able to say that there are now just 82 active cases in regional local government areas under the stage 3 rules. Those communities that have been of greatest concern to us, if I can just give you a quick sense of those, no new cases in regional Victoria across the board. Colac has 25 active cases, of course, though, because of that one outbreak, and that speaks directly to just how infectious and just how quickly this virus can get away from you. One person goes back to their local community, and within the space of a week, one person has meant that some 25 people in that community have tested positive. Greater Geelong more broadly, 16 active cases. Greater Bendigo, 2 active cases. Ballarat has just 1 active case. So those numbers are falling steadily, and I want to thank everyone across regional Victoria, from big regional cities to the smallest of country towns. You're all doing an amazing job, but it is important to keep coming forward and getting tested. It is important that we stay the course. We are very confident that we will reach our target in terms of the 14-day average, and as soon as we can have those those very substantial changes, not one step, but in fact 2 steps along that roadmap to COVID normal, applying across regional Victoria. That's exactly what we will do. That I don't think is too far away. I just wanted to speak very quickly about disability facility settings. There are now 22 active cases, 12 staff, 10 residents. And in terms of aged care active cases, there are some 863 currently active cases in aged care. So those numbers again have stabilised and are falling also. But again, aged care settings and disability facility settings remain a very significant challenge for us, given the underlying vulnerability of so many of those residents and clients. In terms of aged care shifts that have been worked, and this is back to the point of thanking our healthcare workers for the amazing job that they have and continue to do, 4,098 shifts have been filled in private aged care facilities to date, and each and every one of the team from hospitals who've gone into aged care facilities, many of which were in absolute acute crisis, we are very grateful to you, very, very grateful for the amazing job that you have done. Now, I just want to quickly go to bad weather and give you some updates there, because I know that's of concern. And then I've just got a couple of points to make about contact tracing and public health teams. And then Jerome Weimar is here as the Deputy Secretary for Community Engagement and Testing. I think he's well known to all of you in lots of different roles that he's played. He's going to talk about regional public health teams and testing and a few other matters. So just in terms of bad weather first, I can inform you that there have been 386 calls for SES assistance in the past 24 hours. 300 of those have been in relation to fallen trees, 46 for building damage. Affected suburbs: Pakenham 17, Belgrave 16, Upwey 14, Millgrove 12 and Selby 12. The SES Emerald unit has been the busiest again. They've had a really challenging time these last couple of weeks, and I thank each and every member of that unit and all the SES and all of our emergency services. They do an amazing job whenever we call upon them. But SES Emerald unit have dealt with some 75 of those 380 call-outs. Due to severe weather in the Wodonga area, there have been some power outages which have affected approximately 30,000 households. All relevant agencies are working as hard as they possibly can, as quick as they can, to restore power, and if there's any further updates that I can provide, then I will do that in due course. I'm advised that whilst the majority of those are back online, there's about 3,200 that are still impacted, and if we can provide you with further updates on that, of course we will. And I just want to again remind Victorians that a severe weather warning remains in place. Vic SES and the Bureau will provide updates to you and through you to the community a bit later on today. Now, just quickly before I throw to Jerome to talk about some of the quite amazing work that he and his team, 2,600, 2,700 strong team, are doing in terms of our public health response. This morning I had a meeting with Commodore Mark Hill, who is the Australian Defence Force lead here in Victoria. The first thing I want to say is we're deeply grateful. As I said to him, we're deeply grateful to him, to his command, but also to all of his people who are doing really, really important work, and we're grateful for that support. They have well more than 1,000 people who are currently out there, whether it be door knocking, providing tasking and other logistical support from the centre, and then testing, doing a whole range of different roles. Very, very important work. We're very grateful to each of those ADF personnel. Beyond that, I'd also say part of that discussion and part of the work that's going on at the moment for many months now, we've had ADF as well as very senior public servants from the Commonwealth, whether it be the Chief Scientist Alan Finkel and others, that have essentially been embedded as part of our team. They've had full line of sight and they've done an amazing job, and we're very, very grateful to all of them for that advice, providing us with those second and third opinions, giving us that sense of confidence that there is a culture of continuous improvement and that we're finding sometimes minutes, sometimes hours, but there is always that work every single day, every shift, to try and be better, which I think is very, very important. To have achieved substantial improvements in all of the metrics that are reported as part of the National Cabinet dashboard on contact tracing and public health response, despite the fact that the task has got so much greater, is a real comment on just how committed and just how hard-working those teams are. I can inform you that the ADF and Chief Scientist Alan Finkel, who, as I said, have been embedded as part of that response and have been in regular contact with New South Wales and indeed other states in terms of any learnings, any insights that different public health teams might be able to provide from other parts of Australia and indeed the world. As part of that assurance process, that continuous improvement culture and always checking and double checking to see whether there's something that might be improved, the Chief Scientist, the ADF and some very senior officials from the Department of Health and Human Services will later this week be travelling to Sydney, and they will again just double and triple check whether there is anything that is different between our response and the response in New South Wales. The other point to make, of course, is they've got case numbers at levels that we are heading towards, and there might be, when you are dealing with that particular challenge of very low numbers and trying to keep them very low, there may be some insights that they can provide us given that they are in a different place. All of that, though, helps to inform a very much tailored response in Victoria to the challenge that we face in terms of levels of community transmission, in terms of some of the dynamics, in terms of chains of transmission, those mystery cases and where infection is happening. That is very different in Victoria than any other part of our nation. But always sharing information, that's been going on since March, but just double checking and triple checking to see whether there's any further, even minor improvements. I think that's a very important process. I just want to now speak to some other announcements. We will be providing further information on the dashboard in relation to industry settings and particularly in relation to healthcare infections. And we're happy to take any questions about that offline, and if there's any further information that you need, we're more than happy to feed that into the process. We'll also be able to, as I announced yesterday, publish the 14-day rolling averages for Metro Melbourne, but also for regional Victoria, and we will have more regular reporting of contact tracing metrics. I can, in broad terms, I can confirm that we are just over 90% of those cases, positive cases, being interviewed within 24 hours. The reason that there are 8-9% of people that we can't get to within that time frame are the same reasons we've always talked about: not home, you might need a guardian or an adult to interview a child and may not necessarily be present, door knocked and can't be found, and then there will be, not every day, and it is in very, very low numbers, and I make this point not in relation to our disease response or transmission, but in terms of chasing a 100%, that is talking to every single person. There will from time to time be people who are not willing to be part of that process. In terms of close contacts, we are at 99%. So just 1% of people, for exactly the same reasons, cannot be contacted. The door knocking activity that the ADF and authorised officers have led and continue to do of all cases and all close contacts, low tech, an old-fashioned, common sense way of doing things, but one that has served us very well. There's no other jurisdiction, I think, doing that work, but it makes the point that it's appropriate here, and that's exactly why we continue to do that. In terms of, finally, just before I ask Jerome to speak to some other matters, I can announce today that we will, in coming weeks, establish at least 5 suburban contact tracing and public health, that is coronavirus response teams. They will be in the north, south, southeast and west of the state. So we will have across the north, across the east and southeast, the west also. We'll make sure that we have got those local teams who I think come into their own when there is very low numbers, but the tolerance for keeping those numbers low is also very, very small. The notion of pouncing on outbreaks, making sure that when we're chasing 1 and 2 cases and keeping those numbers very low, I think just as regional public health teams, which we have stood up in a number of significant regional centres and been very, very successful, whether it be in the colac outbreak, some positive activity, some cases down in the Latrobe Valley. Those local, at a regional level, those regional public health teams have been very, very successful. And in coming weeks, after consultation with health services, consultation with local government, we will establish those important suburban equivalents of those regional public health teams at all points on the compass, and that'll be about trying to provide the very best and localised response, not to hundreds of cases, that is appropriately centralised, but to very small numbers of cases in local areas, in local suburbs. We think that will serve us very well. I'm happy to talk, probably there'll be some questions I'm sure about IT, both the Salesforce product, which is about trying to consolidate and align many different platforms into one platform. That's happening now, and that just means that there's less pen and paper, there's less manual data entry. It also facilitates the notion of devolving some of our response, so it's not just at the centre, but there's regional teams, suburban teams, and everybody can input into the same platform, and everybody can have line of sight of the same data, the same information in real time. The second product, the IBM product, or what we've referred to in a few recent press conferences as the artificial intelligence product, I can confirm that comes from defence science. That's not its first purpose. It's used for other things, and that's a matter for the ADF, but it has been adapted. It has been retrofit, if you like, to give us some of the predictive capacity that can help you pick up patterns that might not necessarily be obvious. That is in development now, that is being stood up as we speak, and if I can provide any further information on that by way of update and any examples of the insights that it's given us, then of course I'm happy to commit to do that over time. I think that's probably all I needed to run through off the top. I'll now ask Jerome just to speak to some of the issues that he's been doing an excellent job driving and leading, and then of course we're happy to take any and all questions you have.
Thank you, Premier. The next stage of our strategy is all around how we continue to work with the community and how we continue to speed up our work in tackling the remaining cases that are out there. And the Premier's talked about our focus around ensuring that we engage suburban and metro communities, and that's exactly the work we've been doing over the last few weeks around our regional spaces. So over the last 6 weeks, we've been working closely with our regional health service partners to devolve the contact tracing, case management and follow-up of positive cases in their communities. And we do that because they know their communities, they know their environments, and they're able to get on the ground far quicker by being so close to the action. So, for example, over the last few weeks, we've now seen Barwon deal with 429 positive cases in their corridor, getting a hold of over 5,400 close contacts in that process. Bendigo Health have had to deal with 89 positive cases and have managed to trace 1,345 close contacts, and so on. And the strength of that model is illustrated if you look at a situation like the colic outbreak that the Premier's referred to. Just 2 positive cases in that community led to 25 close contacts also contracting COVID. What was important about the Barwon Health response was that all those close contacts were already quarantined because they'd been able to undertake such swift close contact matching, such swift tracing, that anybody who was tested positive was already safely self-isolating, and therefore there's been no further knock-on impact to the wider community. And we've seen similar results in Bendigo, in Castlemaine, in Geelong, where swift contact tracing using well-established local networks and devolved local teams has enabled us to ensure that any close contacts are quickly identified, brought together, safely isolated, and then we go through our full 11-day and 14-day processes as necessary. So it's been a very strong part of our response, and we're continuing to look for ways where we can work with local communities to engage them in the fight against COVID, to give them the trust and confidence to come forward, to get tested, and to deal with those contacts and isolation processes as quickly as we possibly can. We've also deployed our regional and local partners in our incident management teams, again, particularly in our regional outbreaks. So we recognise that not only when we're dealing with a COVID outbreak, we're dealing with complex social, sometimes housing, sometimes welfare issues, as we're asking people to come offline, to self-isolate, and many of them will have a number of other complicated issues that we need to support them on. By forming local incident management teams, by bringing together the local health service providers, the local council, and other local community groups, we can ensure that we deal with all the issues that local community may be dealing with, and ensure that we can help them to support them to safely and effectively isolate over the 10 to 12 days that they need to do so. It's also enabled us to really get hold of those outbreaks very quickly, and we've seen over the last 4 or 5 weeks some quite big outbreaks in regional Victoria being really curtailed and brought to an end far more swiftly, and that's critical to our success. The third plank in our strategy is rapid response testing teams. Again, we've been deploying these for the last 4 weeks across the state. There's now 11 rapid response testing teams, 6 of them within the metro area, 5 of them across regional Victoria. We've now had almost 70 deployments of those rapid response testing teams over the last few weeks. They alone have already dealt with around 6,000 tests in that period of time, and we're applying them in a range of complex and difficult situations. So as well as asking people who are able to do so to come forward for testing when they feel they have any symptoms, what we're also saying is when we're seeing a complex outbreak in a supported residential service, in a disability service, in a complex industrial process, in a youth group within Corio, in an educational setting, even in the Melbourne Seafood Centre, we will deploy the rapid response testing team to support everybody who's potentially impacted to make sure they get tested quickly and safely and they understand exactly what they need to do. And we will continue to deploy those rapid response teams over the coming weeks ahead as the cases start to reduce and as it becomes increasingly important that we get our hands around any potential outbreak that may be occurring. And finally, Premier, we've also launched 4 weeks ago the Call to Test programme, which is dealing with the most vulnerable members of our society, people who are unable to leave home safely. We have now provided over 1,000 tests, 1,076 safe COVID tests to people who are unable to leave the home to ensure they can also get properly and effectively tested. And we found a number of positive cases in our community and be able to deal with them to support them through that condition. So all in all, this is all around our ongoing work around how we support the Victorian community to give them access to safe, effective, reliable testing, but also to ensure that they get swift results and ultimately have trust and confidence in the system. My final request would be to ensure that people who feel they have any symptoms at all, no matter how minor, no matter how slight, please come forward to get tested. Do not wait a day, do not wait 2 days, come forward, get tested, we'll deal with you quickly, you'll have your results quickly so you can get on and know you're not going to put any further risk to people around you. Thank you.
Happy to take any questions you have.
Premier, given what the 14-day average is looking like for regional Victoria at the moment, is there a chance that they might be able to skip stage 2 and go straight to stage 3 on Sunday?
Well, they're already taking one, potentially 2 steps more than Melbourne. We'll just have to be driven by the data, Lunny. The trend is very good, and we're very proud and very grateful to everyone in regional Victoria who is doing the right thing. I know these rules are not easy. I'll just go back to the point I made yesterday, and there's been a bit of commentary about, well, you know, why can't communities that have no cases jump well and truly ahead and jump right now? The key point is that's no cases that we know of, and I think the Apollo Bay wastewater, the sewage testing result just gives you a sense that this can be in a local community and no one knows it, because it does present often very mildly, and of course not everybody who's got symptoms comes forward and gets tested. As I said yesterday, if it was a situation where we were asking all of regional Victoria to wait 6 or 8 weeks before they could take those safe, steady steps towards a normal, then we probably would have said, okay, we need to divide regional Victoria up into different zones based on risk, based on data. I think that they'll be able to take some very significant steps soon because the trend is with us, the trend is good. And that's all it's a credit to the work that Jerome's just talked about, but it's also a credit to every single person across regional Victoria.
I guess what I'm asking is, given that the threshold is 5 or less over 14 days, and yesterday it was at 5.3, so you'd assume that in the next couple of days it will get below 5.
Yep.
Is there a chance that come Sunday they can just skip that second step?
Well, let's not make announcements until we've got the data, but we will ease in regional Victoria based on the data and the science, and we will take as big a steps as we can, provided they are safe. That's the really important thing. And we didn't put a timeline on some of that. We said that it would just need to be about when we got to that 14-day average, because we knew and we expect that we may get to that quite soon. We're very, very close now. But the last thing I would ever want is for people in regional Victoria who've given so much, numbers have got so low, we've got to make sure that when we do take those steps that we've got a good picture of how much virus is out there and that it doesn't get away from us very soon thereafter.
Some contact tracing. Are you adding any people to the overall team whether you collect all these teams up in one, or are you just shuffling people around to more localised teams?
No, I think there'll be additional people, so it'll be a mix. There might be some leadership positions that are essentially from the centre that might go out to those teams. The final design is not yet settled, but the model across regional Victoria is they've been added to the overall team. We'll use some health service staff, for instance. So when I say added, there may be some people who are not necessarily doing this work now, but they're on the payroll. They're working in a hospital setting, for instance. We'll also look to local government, whether there are any supports that they can provide, and then we'll stand up those teams. But I think the majority of those additional team members will be extra, or at least they will be tasked to this important work when that wasn't what they were doing, if that makes sense, Simon.
Why has it taken 5 months of the pandemic for you to get to this stage? We've had questions raised months ago about how, compared with other states, Victoria didn't have that localised capability. Why has it taken so long to develop it?
Well, this comes into its own when numbers are very low, and that's the position that we're moving into now. So,
numbers were very low between the first and second wave.
Well, indeed. This is about continuous improvement. It's not about saying that, there isn't an opportunity to do better. It's looking for and often it'll be very, very small improvements, but the lower the numbers get, the lower your tolerance and threshold for error, the margin for error gets so slim that it's then appropriate to devolve, and that's exactly what we're doing. There'll still be a very, very big team at the centre, but having the most localised response. For instance, I'll give you an example. I spoke with Commodore Hill this morning about the fact that a case, well deep into regional Victoria where there's not necessarily the laboratory capacity would mean you had to send that swab all the way to Melbourne. That it can add 2, 3, 4 hours to that turnaround time. Once you get down to very, very low numbers though, there are a number of health settings, a number of hospitals who can run 1 or 2 tests. They can't do a long run of tests, but they can do very small numbers, and they can turn them around without all that travel time. So, for instance, some things become possible, some things come into their own, some things become absolutely essential when you get to very, very low numbers. So I think that just as regional teams have played a critical role in the low numbers in regional Victoria now and keeping them low, suburban public health teams, coronavirus response teams, will be a very important part of that final push to get the numbers right down and, of course, to keep them there.
That still doesn't explain why you didn't do that, 3 months ago before we...
Well, this second wave is very different to the first wave. Very, very different. And
that you could have prevented the severity of the second
well,
wave
I don't
by
accept that.
implementing some of those things.
I don't accept that at all. The key point here is with the amount of community transmission that we've got, with the amount of cases that we had, a more centralised model worked, and that's not a matter of my opinion. We've gone from 725 cases to 41 yesterday, 55 today. That's a strategy that's working. That's a strategy that it's full of sacrifice. It's full of a lot of hard work from many, many people. And again, I'm deeply grateful to everyone who's playing their part. But I don't accept that view. This is now the time to do this. But there may be other things that I'm not announcing today. There may be other things that become clear that there would be a benefit, and we'd always reserve the right to make further announcements, refinements. That's what a culture of continuous improvement's all about.
What about going to New South Wales, though? I mean, that's something that could have easily been done weeks and weeks ago. I mean, the federal government has been raising that as an issue for a long time.
On that point, there's been constant communication. But it's important not just to find things that are different, but to potentially just to double check that there are no differences. So it's for two purposes. It is appropriate, particularly given what they're dealing with now, very low case numbers. They are where we want to get to and where we will get to under this strategy. It's just appropriate to sit down and double check, triple check. No one could have literally counted the number of times there's been phone calls, Zooms, data being shared. It is absolutely connected. We speak with our colleagues. In fact, they've been doing some contact tracing for us as part of when things were at their absolute peak. So there is a very strong connection, but it's always worthwhile going firsthand, not over a 45-minute Zoom meeting, but in person for as long as it takes, just to double and triple check that there's nothing that might be changed, or any insights, any experience. The other thing too is that it may not necessarily be that there's much found that's very different at all, but because New South Wales are dealing with very small numbers of cases, that's a different challenge to dealing with hundreds and thousands. So they may have some insights into what we can expect to confront, not right now, but in 3 weeks, 4 weeks, 5 weeks' time. So it just makes perfect sense.
When did you first realise that we would need to localise our responses and start establishing suburban and regional response units?
Well, it's not a matter of realising that it had to be done. This is a choice, because the way regional public health teams have worked, and the fact that we've got numbers well down from the peak, so we're into below 100 cases, and we're going to keep driving those down even further. As I said to Rachel, the kind of margin for error gets really, really small, and the Colac example shows you. One person, two people. Next thing, it's 25 people. But if it's well managed, as that outbreak has been, and I want to congratulate all the team at Barwon Health and all their partners, and indeed the people involved. They've been asked to do certain things, they've done them, and that's why, to the best of our knowledge as we stand here today, something that could easily have been 100 cases or more is not, it's 25.
When did the public health team recognise that this would be an important step to take?
I think that people have wanted to see how regional teams worked. It's been something that's been talked about for a while. It's not necessarily being stood up next week. We're announcing that we're planning to do it. We need to get that model right. We're very confident that we will.
But on Rachel's point, at the start of the pandemic, like right at the beginning, before things even got out of control in the first wave, Professor Brett Sutton had lauded New South Wales' decentralised system, and that was a good thing. So we have known for a very long time, even before the first wave, that a decentralised system would potentially help in being able to contact trace and suppress the spread of the virus. So why has it taken 5 months to actually implement it?
Well, because the judgment was not made that it would deliver a significant dividend when you had cases at 700 per day. But it does come in. Well, you need to speak to him about those comments. I'm not here to interpret what he may or may not have said. With the greatest of respect, in terms of when a devolved model is of its most utility, its greatest benefit, it is not when you've got 700 cases. It is when, in fact, it can actually make things a good deal more complicated. If you've got ADF talk about a single source of truth, having all the information sitting in one place, and having the certainty that the numbers you're looking at are in fact the real numbers, and you've got a real picture. The notion of devolving out and trying to duplicate and replicate, fighting 700 cases a day, there is an argument that could in fact not be the right thing to do. However, and this is the key point, when you get to a stage when numbers are very low and you want to keep them low and the strategy is depending on you keeping them low, then you can devolve out and you can have that really quick, localised response where you try and use as much local knowledge as you possibly can. That's exactly why we're making these announcements.
Given the have 700 cases.
Let's go to Bridget and then we'll go to Rachel.
Given the outbreaks at the start of the second wave were concentrated in the north and the west, why now?
Well, but just think about that for a moment. So the outbreaks were concentrated in the north and the west. We essentially had a devolved team. Like the majority of a team that was a couple of thousand people big from Lonsdale Street were working almost exclusively on outbreaks in the north and the west. So the office building you work from when you're at that stage of a wave is far less important than when you are down to ones and twos and you have to keep it at ones and twos. So that's the point that I'm making. That's the advice that I have, and that's the decision that we've made.
We didn't have 700 cases back in June. We had days of 0. Are you saying that this localised, system that you're introducing now, these improvements, wouldn't have been useful then?
Well, it's not a matter of me trying to interpret what might have been useful or not in a very different wave 3 or 4 months ago. I don't know that.
I'm talking about the beginning of the second wave. I'm asking whether it would have been useful in prevention of the extent of the second wave.
Well, that was not the advice. It's not. I just want to make the point. When you are about making continuous improvement, then that's exactly what you have to do. And that's not about digging in and saying, well, this is perfect and it can't get any better. That I don't think would be a very productive way to go. What instead we've done is at different phases of this pandemic as it has presented. We have employed different tactics, a different strategy, done things differently. For instance, we weren't door knocking right at the beginning of the second wave, but very soon thereafter, we knew that that was an issue, and that making sure that everybody was where they were supposed to be, but also to provide support, information, that was a useful thing to do. I haven't got a total door knocking number, but it's many tens of thousands. So what is appropriate, what is effective at one point doesn't necessarily hold for very long, and that's why you have to always look for those improvements.
Well, do you acknowledge, though, that if you put into place some of these systems before, going up to Sydney earlier, bringing in place these IT systems, getting these localised hotspots happening, if you got that into place earlier, perhaps would you acknowledge the second wave would not have been as severe?
I wouldn't say that localised public health teams or regional public health teams or some officials going to Sydney to do a triple check. It's not like they haven't been talking. They're in constant contact. I wouldn't accept that. What I would say though is that the only way to avoid this sort of discussion is to blindly say the system's perfect and it can't get any better. I'm not saying that. I've never ever said that. We all have to. There's no rule book. There's no playbook. There's no kind of guide here. This is something that none of us have done before, and therefore you all learn from each other. And there are plenty of insights that we've provided to New South Wales and Queensland and South Australia, and it's a proper model where we share not just resources, but we share our experience and our insight, so that everybody can do the very best that they can do. That's what continuous improvement's all about. Alex.
In July, you did say that the resources were adequate, that everyone mostly was being contacted as per the thresholds that you had. So when did you become aware that that was not the case and that there was...
So what time period, sorry, Alex? I didn't hear the first bit.
In July, you said that resources were adequate. So this is when you'd boosted them up to 2,100 and said that you would need more in the future, which later became 2,600. But before that, you maintained that there was nothing wrong with it.
Well, I don't think I've
maintained there was nothing wrong with that after, and it wasn't under-resourced. So when did you become aware that the contract tracing team of teams had issues and that needed to be adjusted?
Right. So I think, Alex, as I've tried to explain on many different occasions, and we can go back and check the record, but I think every time I have spoken about resources, I've always been at pains to say, and I can't rule out the need to do more. So logic tells you, as the task grows, the team needs to grow. And that's exactly what's happened here.
But it's also looking back at that point that the 2,100 wasn't adequate at that time.
Well, I don't know.
You claimed it was, but now when you're looking back at it...
Well, I'm not here to make claims. I'm here to talk about facts. And as the task grows, the team grows. And I can't rule out, just for the purposes of absolute completeness, I can't work out that the team won't grow tomorrow or the team won't grow the day after. It's grown at every point it's needed to grow. The other thing too, if you sort of flip your question, if we look ahead 3 or 4 weeks and we've got numbers that are much lower than these, the temptation for some, and no doubt there'll be some calls for, well, why are you continuing to employ people when numbers are, why is the team as big? Why hasn't it shrunk? Because the task has shrunk. Well, there'll need to be a real sense of conservatism in that to make sure that we've got a workforce that can flex up, that can be boosted in the event that we had an outbreak, and we needed to have not just an excellent response, but something even above that. There will come a time when even for instance, the COLAC example that's been used, you'd even want to do better than that if you can. If you can get to people even faster, then of course that's always what you'd aim for.
To that point, though, the teams were disbanded. There is allegations that the teams were disbanded between the first and the second wave. Have you gone back and looked at that at all?
Well, part of the problem, I think, Alex, is when you believe, to the best of your judgment, to the best of the advice, that you had it beaten, only to then clearly we hadn't. You have to learn from that, and that's exactly that's some of the thinking that I think will go on, already is, but it will continue to go on as we move into this next phase. Because as I've said a few times today, the margin for error is so small that I think that it would be a very wise investment as we get these numbers down, and we want to keep them down, to have a sizable workforce that are both working each and every day and others that we can call upon quickly. That is exactly the way that we'll go. And whilst we've made some announcements today, and we'll have more detail about that in the coming days and weeks as we stand those teams up, I certainly can't rule out taking further steps, looking at different ways of doing things, modifying some of the things that we do. That's what that constant search for minutes, rarely hours. It's not often that you can find multiple hours, but if everyone's looking for minutes, ultimately that adds up to a much better response. And that's some of the things I had a very detailed conversation with Commodore Hill about this morning.
So are these
Did we take our
improvements?
foot off the pedal then at the end of the first wave, having just said we believed we had it beaten?
Well, I wouldn't say that, but I think what happens is you respond to the case numbers, you respond to the data. But I suppose, Lundy, it speaks to the fact that this can be out there and bubbling, and you don't necessarily know it. And that's why you have to be very, very cautious, particularly. And again, comparisons between the two waves are quite hard to make because we didn't, for instance, have, to the extent we have in the second wave, the amount of large household, high-risk workplace that sort of interplay between those. We didn't have many of the communities and postcodes that have been the centre of the second wave. We didn't see very many infections there at all. Let me give you one example. We haven't talked about this for a little while because some of the steps we've taken, I think, have largely addressed it. But for instance, the notion of insecure work, the notion of people going to work even though they were sick through a sense of, well, I can't afford to not work the shift, that was not really a feature of the first wave because we had different groups of people who were positive cases. We didn't have the percentage, particularly of blue-collar workers in the north and west, for whom insecure work is sadly a feature of so much of those industries, so much of that economic activity. So the two waves are very different, but there'll be lessons from all of them. And what I'm saying to you today is every day we're searching for those, and every day we're searching to find the minutes that all add up to the quickest and best response possible. And I don't think that process ever ends. I don't think you'd ever say any model in any state or any nation in the world is perfect. There'll always be room for improvement, and that's why you have to search for that every day.
You
So
mentioned
any
the
of
Colac
these-
example,
Sure.
Premier. I mean, it took them days, though, to plead with the government for assistance with testing and also with handling the outbreak. And
I'm talking about Colac in the last week.
Okay, you're just talking, not the initial first outbreak.
No,
where
I'm
they
talking
brought
about
in-
what Jerome is talking about is events in Colac in the last week, where one person travels from Melbourne. There's then obviously the first person that was infected by that person, and it spreads inside a week. Actually, it was less than 7 days, and goes from 1 or 2 as the first cases to 25 people. That has been locked down. I think regional public health team's been a really important part of that, but as well, those 25 people have all done the right thing, and we're very grateful to them.
Can I ask you about the first wave of Colac, which it did take them days, though, to plead for assistance from the government, and then eventually Barwon Health got involved after some days. Is
Yes.
this sort of model trying to fix a lag like that?
Well, this sort of model's trying to get the best, fastest response to any outbreak anywhere in the state. That's exactly what we're trying to do. I can't change what might have occurred in the first wave. And look, there was a bit of back and forth around perhaps some people who thought they were close contacts but in fact were not. There were some testing issues. Again, I don't have the notes on that exact case here with me now. But again, no response is ever 100% perfect. And you need to acknowledge that, and then you need to use that as a source of motivation and an absolute compulsion to find improvements. Rarely are they massive in nature, but even lots of small improvements add up to a better system.
The Prime Minister said that he hopes that the thresholds you announced on Sunday were the worst case scenario and that Victoria...
Well, I just say to the Prime Minister, the worst case scenario is being open for 3 or 4 weeks and then being closed down again. That's the worst case scenario. Absolutely, that's the worst case scenario. And I'll continue to work very closely with the Prime Minister and his team. We're very grateful for the partnership that we have. But in my judgment, if I could be so bold as to have a judgment on these things, I think I've got some insight into what's happening here in our state. The worst case scenario is you're open for 3 or 4 weeks because you pretend it's over when it isn't, and then we're all back locked down again. the only way, the data, the doctors, the science, the only way to go is to do this in safe and steady steps. We'd all like it to be different. We would all like to be able to open everything up tomorrow. But we could do that. We could do that. And there'd be 15 minutes of happiness, and then we'd be back locked down and arguably facing an even worse situation than we face now. Not to downplay the challenge that we face now. It's very, very significant. But when all your advisors, when the science, when the data, and data trumps modelling, let's be very clear about that. And every day that passes, we have actuals, not just what we project. We have actual data. When it's as clear cut as what it is, you can't open at 41 cases, you can't open at 55 cases. You can open at a much lower level, but only in a safe and steady way.
Business is wondering why they can't open at New South Wales level, for instance.
Yeah, I've seen some of that comparison. I saw some comparisons that I don't think are either helpful or accurate in any way. The notion that New South Wales would be in certain settings if our rules applied to them. Well, of course, our rules don't apply to them because they're New South Wales and we're not in the same situation as them. They're not in the same situation as us.
But businesses do work across borders, so we
Yeah, they
need
do,
some
but-
kind of consistency between the states.
Well, okay, Alex. So if I can, let me just try and deal with the question you've asked. So, for the purposes of national consistency, what would be preferable to ignore the fact that we have much higher rates of community transmission than New South Wales? That doesn't make any sense.
But you're talking about getting it down to low enough case
Yep.
levels where your contract tracing team is
Yes.
spot on and amazing. So if we could get down to levels where there was low community transmission and it
Yep.
was similar to levels of New South Wales, then why
Yep.
couldn't we operate on the same scale in order to enhance business between both of the territories?
But that's exactly the roadmap that I announced. So once we get down to low enough case numbers, then our settings will be not so different to New South Wales at all.
Between 5 and 0 for a 2-week consistent period.
Yeah.
While they have retail and cafes open when there is 17 cases announced new per day.
And how much community transmission have they had? Have they had a second wave? No, they haven't. So the situation they face is different.
Okay, so if we have 17 cases with no community transmission, then you would be happy.
No,
to
I'm not
make-
talking about daily community transmission. I'm talking about community transmission in aggregate. We have had thousands of cases of community transmission. Trying to compare where New South Wales is at the moment with the epidemiological predicament, the facts, the second wave as it's presented here in Victoria, they're not either helpful, and they're not in any way accurate. We will, however, get to a point, you're right to say, we will get to a point where our settings will be very close, if not identical to New South Wales and South Australia and Tasmania and every other state, but only when we get the case numbers down to the lowest level. Now, you reference the targets, what we're aiming for in the final steps, those last steps towards COVID normal. That's what we aim to get to. Now, we'll all work as hard as we possibly can to get to those numbers, but whether they're achievable, that will be in the hands, well, it's about hard work, it's about everybody who's symptomatic coming forward and getting tested, but it's also, it'll also be driven by the data and exactly what happens. And we've said consistently that if you were going along and you were on track to meet your target, and say in the second or third last days of that 14-day period you had an outbreak, you had 6 or 8 cases, for instance, but you looked at the specifics of those cases, and I had a long conversation with Professor Cheng this morning on this very issue, you'd look at each of those cases and you'd make a judgment. Are they contained? Is there any sense that it's perhaps bigger than we think? Can we be confident that we've got a lid on those numbers that skew the target, but the individual circumstances of that, common sense, will always guide us? So I don't think we're in fundamental disagreement. We're all working to get to the same place, low case numbers and defendably low case numbers, as every other state. And then there'll be the national consistency. But at the moment, if we said, well, we need to try and align the rules, you can't do that because we're in a very different place.
Premier.
Not just today, I mean, but in you look at the last months, this wave from almost every perspective is very different to what other states are dealing with.
I mean, that you will move to align the rules as we get lower down to those case numbers, or is that never going to happen?
Oh, well, look, again, the exact settings that are in place in New South Wales are a matter for the New South Wales government. For instance, their border is closed. We'll get that border open, though, by driving our numbers down as low as we possibly can. So there'll be an ultimate point where things are in broad alignment. But even coming out of the first wave, the way they treated poker machines, for instance, was different to the way we did it. The way they treated all sorts of different businesses. There will have been, whilst there's similarities, whilst there is a need for consistency in that ultimate sense, things are different in Sydney, different in regional New South Wales than they are here. Lots of things are similar, but there are some differences also. Sorry?
Business support far off getting landed yet?
We'll make some announcements quite soon, as I said yesterday, and I think.
Can you say when? So many businesses are making life, in business sense, life.
The restriction announcements that we made are painful. They're challenging. We acknowledge that. We understand that, but we're giving business an opportunity to provide direct input to the government about the support that they need. And I think that's a fair and reasonable thing to do. I think that's a very important thing to do. And as soon as we are ready to make announcements, they'll be substantial, very substantial. But it isn't for today, but it will be soon.
Will it be within the next week?
Oh yes. We'll have more to say soon, but today's not the day for that. So and the reason, sorry,
Premier, what would be your message to a business owner that is making that really tough decision as to whether to lay off staff, whether to shut down pubs, are shutting,
Well, there are JobKeeper arrangements that remain in place. There are job seeker arrangements that remain in place they do change, but they're there for some weeks to come before they go to a lower level. There is substantial business support that we've provided already, and we are going to add to that, and we will add to that in a substantial way. But it's important to get the development of that package right, and I think that I put it to you this way, Simon, if there's criticism that it's not today, it might be in the days to come, because that's being driven by listening to business, fine, people can make that call if they choose to. I think the most important thing to do is to listen and try and get that understanding. And it might not necessarily be the vast majority of the package, but there might be some smaller targeted things we can do. And the best way to develop those things is by listening, and that's exactly what we're doing.
Will you consider Victorian-style JobKeeper and job seeker for when?
Well, there are ongoing consultations, and they will inform the design of the package, and I think that's the best way to go.
Will you
Bridget?
consider a Victorian-style JobKeeper and job seeker for when the federal support ends?
Well, the federal support doesn't end until next year. It comes down from one level to a lower level at the end of the month. We're in discussions with the Commonwealth. We'll finalise our package of support, and we'll continue to work with the Commonwealth, and we'll all work together, I think, to make sure that hardship drives the policy response, and we do as much as we possibly can to get businesses, families, workers, communities to the other side of this.
So is the Prime Minister being as helpful as you'd like at the moment?
I've got a good relationship with the PM. I'm not in any doubt that he, just as I, understands that there's no place for politics in this. There's just no place for politics. This virus will not be defeated by playing politics. It'll be defeated and put back into a manageable place by all of us being focused on working as hard as we can in as unified a way as possible. That's our challenge. It's big enough without adding any other challenges. That's why I've made the point last couple of days that politics has never been less important to me. That is not leadership. It is not what's needed. If you try and do just what's popular, then we'll be open for a little while, yeah, and then we'll be closed again, and that's not good for anybody.
So just on what Bridge just asked then.
They've taken swipes at you, they've taken swipes at your decision to extend the state of emergency legislation, as well as the contact tracing efforts here in Victoria. Do you think they are playing politics?
Well, that's entirely a matter for others to judge. I'm focused.
Do you think they are? Do you think?
Well, I'm not here to give you. I'm not, with the greatest of respect, Samaya, I'm not here as a political commentator. The political commentary is for you. The analysis of how you see things playing out, that's entirely your role, and it's a very important role. I work well with everybody that I need to work with. That's what this job's all about. It's not about what political party you're from. And frankly, leadership in a crisis is never, ever about politics. It's about doing what is right, not just doing what's popular, because that won't get you anywhere. Or nowhere in a sustained sense anyway.
Just back to what Bridge was asking
Sure.
in terms of JobKeeper and JobSeeker,
Yep.
you said hardship will drive the decision. How much hardship do you think is going to be created by the drop in JobKeeper payments, and is there a case for Victoria topping that up, given what the Prime Minister said yesterday?
Yeah, I absolutely understand the question and why it's asked, but I have been pretty consistent about this, and it goes to the point about how you best engage to get the best outcome. Not the best outcome for me, the best outcome for Victorians. And I think you always maximise your chances of getting the best outcome if you have those sort of really significant discussions, not so much at a press conference, but you do that one-to-one, and I'm grateful to the Prime Minister for the fact that that's the relationship we've had, that's the way that we've done things for a very long time now, and I just don't think that should change, and I don't think that it will.
On the JobKeeper, you said that you were going to speak to the Prime Minister about women working in childcare that were reporting
Yes.
much larger job losses. Have you had a chat to the Prime Minister?
I understand that I've not had a conversation with the Prime Minister on that issue because it was, I think it was allocated to ministers, and they've had James Merlino as the Deputy Premier and Early Childhood Minister has had a conversation with Dan Tehan. Alex, you remind me about that. I'm more than happy to chase up what the outcome of that conversation was. I'm not entirely sure. Obviously, those settings do change quite soon in relation to childcare opening up again, which I know is welcome news for parents and particularly women across Victoria who, for not the best of reasons, but it's a reality, so you have to acknowledge it, finish up often carrying much more of that childcare load if you don't have a sector. Plus, there are many, many women who work in that sector, and we're very keen to get them back to work as soon as we can as part of that 101,000. Let me follow up with James where that got to, and one of the guys from the office can chase that up for you.
In terms of other things that you were going to give to the federal government, they were
Sure.
also promised that they would be able to see the modelling in relation to the roadmap,
Yep.
but they say that they haven't received that yet.
No, I think that the Chief Health Officer and the Deputy Chief Health Officer have been in contact. If they haven't already, then it's an active thing. They're in contact with their public health colleagues at an not AHPPC, to be at a CMO and Deputy CMO level. Again, I'm happy to chase that up. We're more than happy to be as clear as we possibly can be. And look, on modelling, as I said before, data always trumps modelling. Actuals are always much more useful than what you assume to be the case. This thing's really challenging to predict into the future, very, very challenging. But you do your level best to put as many inputs into a model, run it again, not just one uni but two, and we will continue to run these models based on not so much assumptions. Well, sorry, assumptions will still be part of it, but today's data, yesterday's data, all the data that comes in along the way, that will inform the model also, and it'll inform the outcome, and it'll inform and become a more reliable predictor of what the kind of case number trajectory is and when we might find those levels. And that could mean dates change, all sorts of changes can happen based on actuals, and the fact that it's a common sense thing. It's also a rule when it comes to public health and infectious diseases. There's nothing better than data. Data is always better than any model, even the most sophisticated model you can possibly design. On the issue of opinions, we've got a fantastic scientific and medical community in this city and in this state, and it's fair to say, if you put 100 of them in a room, they'll come up with many different views on many different issues. That's a healthy thing. That's a wholly good thing. But at some point, this is not an academic exercise. It's not a doctoral thesis. This is live, it's active, you have to call it, you have to make a decision, and then you have to get on and get the job done. And that's exactly what we've done.
I mean, business is really worried that the targets are too low. They're worried that actually Victoria will never be able to achieve them, and some of them are worried they're never going to be able to reopen again under your roadmap. Is what you've set out this week realistically achievable for Victoria?
It is. For instance, if you'd said, let me just use this as one example. Many of the same people, and I'm not criticising the fact that they are concerned that these numbers are very low. They are very low. And they have to be in order to defend that normal and not be bouncing in and out of lockdowns. If you'd maybe said to many of those same people, and again I stress, I'm not criticising them in any way, but if 3 or 4 weeks ago I'd said to them, we're going to get regional case numbers down to about 5 a day over a 14-day period, that we would be able to manage an outbreak like the Colac example. Many of them might have said, well, no, you won't be able to do that. That'll all be too hard. Why are we pegged against that? So I suppose what I'm saying is businesses, workers, families, communities can be positive about the fact that the strategy is working. And the regional Victorian example, testing numbers have remained above the WHO level. We have had outbreaks. We have had some quite strange outcomes, particularly the Apollo Bay sewerage testing. But we have driven those numbers down to exactly the sorts of levels that we need to drive them down, at least as a goal, across metropolitan Melbourne. Now, as each day passes, as each set of actual data, not presumed or assumed data, gets put into the model, things become more accurate, things can change. We always reserve the right to make sure that there's common sense involved in this. And as I said before, I think to Alex's point, if there was an outbreak or a series of cases on the last day of a 14-day period, then we would very, very carefully look at each of those cases and make a judgment about, did that materially change the risk? And if the answer back was no, well then there are circumstances where you could still move forward. But it is a bit too early for us to predict exactly where we'll be. We've done our best off a model that is robust, arguably one of the most significant modelling exercises we've ever seen in our state. But again, the data, the actual numbers, always trump the modelling.
Just to go back to Alex's point around modelling and data, how much of the, I guess, what did the Victorian government provide to the modellers to ensure the modelling was very specific to Victoria?
Well, all of our, well, let me give you, I'll try not to be as descriptive. I'll try and give you a list of things that I know were inputted. Exactly how much weight was given to each, that's the data. I'm not a data scientist, so it would not a matter for me, but I'm happy to try and follow up. Our outbreak data, so real-time, actual information from outbreaks, obviously case numbers, all the detail that sits behind how the second wave has unfolded was, to the extent that the modellers believed necessary, it was all provided to them, that all that data's there, and then they build assumptions beyond that. But the key point here is, notwithstanding the point I made about the fact that there will always be debates and discussions between fantastic, well-qualified people. There will always be different debates, and that's not a bad thing. You do have to call it at some point and move on. You can't have an endless debate for, months. But the issue here is that many of the inputs don't relate to the virus. They relate to human behaviour. They relate to movement. They relate to how people will behave once rules are eased. And that's really challenging. And you can't do 4 or 5 inputs because there's variability within human behaviour. It's almost endless. But we've done, and you've heard me talk many times about millions of Victorians making hundreds of choices each day is hundreds of millions of choices that all can impact how much virus is there, where it spreads, how fast it spreads. There's more than 1,000 of those inputs that have been put in. They're everything from the weather to movement to compliance, all sorts of different things. So it's a big and rigorous and robust process. But it doesn't replace actual case numbers. Nothing can. It's about trying to predict to a high degree of scientific and mathematical certainty, but not complete certainty, where we're going to be at different intervals. If we are ahead of that curve, if we are making progress earlier than we otherwise thought we would, that's all to the good, and we will factor that in. And again, this is not a static thing. It's not like it's been run and now that's the only model. The model will continue to evolve as more and more inputs that are less about speculation or less about trying to presume what people will do. It'll be more about hard data, actual data.
Premier Councillor Sisting has told the hotel quarantine inquiry today that DHHS had ultimate responsibility for hotel quarantine. Given that you're announcing a suite of improvements in that department today, where's the Health Minister, and do you still have faith in her? I
do. She's off attending to very other important matters. She has other very important matters, I should say, sorry. She has many different things to do. We all do. And that's why much as I'd like to be able to say, Rachel, that the only hour and a half that I have to do things in any given day is the hour and a half I get to spend with you that I enjoy above all else, it is not. I do lots of meetings. I was up early today. No doubt the Health Minister was too, and I'll be up till late tonight. We've all got lots to do. I have confidence in her, complete faith in her. She's working as hard as she possibly can, as we all are, including you guys.
And just on this protecting our healthcare workers plan that you
Yes.
said in this press release was launched on August 25. By August 25, we'd had almost 2,800 infections in healthcare workers.
Yes.
Why did it take that many infections and almost 5 months to launch a plan to protect healthcare workers from COVID?
Well, I wouldn't say that that was the first time there was a plan. There's been plans, and I think I don't have the numbers to hand, but many times, and indeed well before that day, I think I took you through, in a really practical sense, the amount of work that goes on to receive orders for PPE from the centralised warehouse, to package them up and to get them out within the same day. Many different plans, a lot of hard work. But given the increase in numbers, we said we needed to go and do a big piece to analyse exactly how much of that was hospital-based. And I'll just remind you, if memory serves me correctly, first wave, about 22% of infections amongst healthcare workers were acquired in hospital. I think that is now closer to 80%, so 79, I think, if my memory is correct. High 70s in any event. I'll get the numbers for you. But two very different waves, two very different circumstances. So I wouldn't accept the notion that just because we released a comprehensive plan there based on the latest epidemiological analysis and a proper review, that there wasn't a plan before that. There were many plans, lots of hard work, and it's appropriate to update that and sometimes to bring together lots of different plans into one strategy, and that's exactly what we've done.
Is there any
Why
chance
aren't
kids in
COVID
Year 6 could go back to school at the start of Term 4, given it's their last term in primary school and transition?
Yeah,
to
I
high
understand
school?
that that's a milestone year. I've got a year 12, a year 10 and a year 8 in our house, and they were all grade 6s, and it was all a really important milestone for them. No one's in any doubt about that, but it's too early for us, Lundy, to be able to confirm what those arrangements will look like other than the announcements we've already made. So week beginning the 5th, remote learning continues in Metro, but there's the GAT and some other assessments. Following week beginning the 12th, Prep 1, 2, 11, 12, Year 10s for the purposes of any of those Year 11 subjects they're doing, and specialist schools. In regional Victoria, obviously, they are all students at all schools back.
Premier, why aren't COVID positive Victorians being told to upload data to the COVID Safe app? Why isn't the Victorian government using it?
I'm not sure that they're not being told to do that. I'm happy to chase it up though. Look, I'm regularly invited, if I can be no way critical, Bridget, but I'm regularly invited to tee off on the app. I am. It's a fact. I don't know how many questions I've been asked. I just want to make this point. The app comes into its own when we're open. That's when it is at its most powerful, right? If you are at home, or if I had to list my close contacts, chances are most of you will be my close contacts because I spend roughly 2 hours in the same room as you, even though we're distanced. In terms of face-to-face 15 minutes, that'll be my family. That'll be a handful of senior staff. So I would be able to, like so many Victorians, I would be able to list my close contacts, and I wouldn't need a Bluetooth handshake, an electronic handshake, to tell me who I had been with. However, once we start opening up, I encourage everyone, do what I've done, do what Kath's done, download the app. It'll come into its own, and hopefully it'll be as effective as it can possibly be once we start to open up. And we're all spending time with people that we can't necessarily list because we don't actually know them. That's when the app comes into its own. It's fine to keep inviting me to be critical of it, but I'm not going to, because the time when it will be really important is not now. It's when we start opening up again.
On these suburban response units, you'll be working with local doctors and local
Correct.
government.
And local hospitals as well.
Local hospitals as well. Local councils have their own environmental health
They do.
policies similar to to a public health team.
They do.
Have any of them been seconded to the DHA?
I understand, yes. I understand we've been drawing on those resources. Let me come back to you about that. But
Since when?
I'm not sure, but I think we've been. It's fair to say that any public health physician, any person who's got that kind of expertise in infectious diseases, and these would be the local council, environmental health officers, I think is the term, if I can remember correctly. They deal with the Legionnaire's outbreak, food poisoning, all of those sorts of things. Really important work. I think we've been making good use of those people, and many of them, probably before we even thought to ask them to help, were volunteering to help. So let me try and come back to you on that.
Yeah, can you just
Notwithstanding, they've got their other work to do too, even though it's probably different work because the amount of places that are closed, but they still do have their own important functions to
how
perform.
many and since when?
Sure,
they've been
that's fine.
utilised? Yeah.
A person from the Alfred has just appeared before the inquiry and admitted that they actually used their own staff contract tracing program because the department's contract tracing wasn't very prompt. Do you think that's a vote of confidence in the state's contact tracing team that one of our top hospitals took it on to do it themselves?
Well, I think it's important to acknowledge that hospitals, by and large, do their own contact tracing, and that isn't new.
What about the fact that they said it wasn't?
Well, I don't know what they've said, and I don't know how well informed they were or what basis they made that claim. But hospitals have, by and large, perhaps even more than that, actually, do their own contact tracing. That isn't something that's new, and that's not something that'll change. They're uniquely.
The fact that they've commented on, they've specifically commented on the department not being prompt. You don't think that's not a vote of confidence?
Well, that's,
in the system?
again, I haven't seen those comments. I'm not here to comment on a process that is underway. If I were to spend all my time here before you talking about evidence that's been led, then we would scarcely get to something else, anything else really. I'll speak once the findings come out. But in terms of hospitals doing contact tracing, that is not new, and that is not a reflection, as that individual seems to have opined, about performance. It is a reflection that hospitals are uniquely placed as health professionals with an acute understanding of patients and staff and movement in and out of the facility they run to do that contact tracing themselves. It's an integrated approach though. They work with the public health team, but that's just the best use of the best skills, Alex.
How has the roadmap to recovery impacted unemployment modelling, and how many more Victorians do you expect to lose their jobs over the next few months?
It's too early for us to be able to put a definitive number on that. Part of consulting with business obviously means you formulate a package, and the package will have a direct impact. So there'll be a time for us to speak in more detail about economic modelling, but that isn't today. Hopefully we can provide some updates on that soon.
Brett Sutton told radio this morning that the curfew wasn't his idea.
Sure.
Can you tell us whose idea it was?
Well, the curfew is about the enforcement of these rules. It's not about crafting the rules. It's not about crafting public health measures. I'm not quite sure what the point here is. There are only certain reasons to leave your home. If you don't have a valid reason to leave your home, then you can't leave your home. And the fact there's a curfew in place, that does grow by an hour. It extends out to 9 o'clock quite soon. That just means the job of Victoria Police is much, much easier. It limits movement, and it has been, I think, always hard to attribute one measure and exactly how many, what percentage of benefit did it give you, but I think it has been significant. It's made the job of Victoria Police easier. It has limited movement. There's less people out and about because only people who've got a lawful reason to be out are out. And what we know, if you... Sorry?
Was it a big poll idea?
Well, ultimately, all these measures are the product of advice. Some of that's public health advice, some of it's law enforcement advice. For instance, when it comes to industry support, that's not a matter of public health. The Chief Health Officer won't be devising that. So there are different things and we have different inputs, but it's a decision that it's a very challenging decision to make. It's not something we've had to do in the past, but from my point of view, it is working. It is absolutely working, and I think it's been a key feature of limiting movement. And we know, back to the science of it, if you limit movement, you limit potential for transmission, and that means you finish up with low case numbers. And that's what we're all driving towards. That's what we want. That's what will allow us to open up.
Last question, please. The Victorian government earlier this year to implement the program. Are you able to walk us through why you rejected that offer at the start of the year?
No, I can't speak to the specifics of that. What I can say, though, is that we have a product that's the same as New South Wales. We have the same platform now. We're moving to a different one, and that's about connecting all of our different systems into one place. We think that's really important. There's been ADF from a logistics point of view. There's been ADF input into that. The other product that is probably probably a bit more exciting. It's not just a platform. It's using technology that's really for other purposes, and that's the key in terms of having the ADF, as they have been since the bushfires, at the centre, giving us their specific skill set. The notion of using machine learning, artificial intelligence, predictive stuff that's not built for a pandemic but is really valuable in these circumstances. It lets you see patterns that might not be obvious, or it lets you see patterns that would take you thousands and thousands of hours of staff going through things. So all that time can be saved, and you can in fact find some things that you might not necessarily find. That's the IBM product.
Are any of the improvements that you've announced today an admission that the system may not have been as good as it could have been?
I wouldn't see it that way. What I'd say is that wherever you think you can improve, then you should. And there are different times. Sometimes when you are swamped, that's not a great time to move to an entirely new IT platform. I think common sense just tells you that. And you find workarounds. You do some things manually that you can now, because we're facing a different challenge, you can move to a new platform. And those platforms will run side by side for a period of time so that you've got a redundancy in case there were any issues. But that's been a big project. A lot of people working on that, and it's really important to have the best framework you possibly can. And again, those are two big steps, but I wouldn't rule out a third and a fourth one if, in fact, the data tells us and experience tells us that we can do even better.
So in layman's terms, how will it work? What information will be in this system that used to be done by hand and...
So it's everything from case interviews, testing results, notes from outbreaks. It's everything that sits in a number of different systems being put into one platform and allowing people in every place to be able to have line of sight of that, which I think is a very, very important thing.
Blue Cross Ruckers Hill Aged Care Facility in North Kit, they have 119 cases, but we first learned of that outbreak on Friday.
Yes.
Why are you waiting until aged care facilities have 119 cases to inform the community about that cluster?
Let me chase up the Blue Cross outbreak. I don't have a note in front of me about that, but I'm more than happy to chase it for you.
Mine's also just a general comment around why we're waiting so long to make public this information that the public...
We try and provide the information in as timely a fashion as possible. Let me.
Outbreaks grow to 119.
Well, Samaya, one case. No, hang on. No. One case at an aged care facility is considered an outbreak. So volume is not the issue here in terms of when it's treated as an outbreak. It's an outbreak from one. Everyone gets tested, the place gets locked down, people get moved if there's shared bathrooms, if there's not, in the clinical judgment of their treating physician, if staying in place is not the best way to go. So I don't know that the notion of outbreak is not a function of numbers. Even one infection in an aged care facility is considered an outbreak.
I understand, but then why aren't we finding about aged care outbreaks at
Sure.
the start of the outbreak?
Let me chase that up for you.
And is there any way that we can start having a public register of outbreaks now that our case numbers are coming down? We're dealing with 4
Sure.
cases today.
I'm more than happy to chase that up for you.
Instead of just
Well,
publishing
today
details
we
in
have announced a
clusters.
bunch of stuff that's being added to the dashboard, particularly in relation to some workplaces and particularly healthcare infections. I'm more than happy to raise with the team the notion of some other information being added to that again.
Given India's got around 100,000 cases of COVID-19 a day, are you comfortable with the prospect of hosting their cricket team for the Boxing Day test? I know it's a couple of months away.
I don't have any public health advice that says that would be the wrong thing to do. I think that quarantine arrangements, testing, all of those protocols, I'd have nothing but the utmost confidence that Cricket Australia and the ICC would work through all of those issues, just as we will once we get to the Australian Open Tennis, where we will have players come from literally all over the world. There'll be arrangements that will have to be put in place, and they'll be based on the best of health advice. I think all of our all of our major events and our big sporting codes and leagues and those who administer those sports have done nothing but work closely with our public health team. And I think that's been a very good thing.
The medical community is getting increasingly concerned about the impact of an elective surgery blitz and then the flow-on effect to private and non-urgent surgeries. Will there be any movement soon on reintroducing elective
So
surgeries?
sorry, on the blitz is a good thing or a bad thing?
They're saying it's a good thing, but it's
Yep.
also you've got to get through the blitz before you can
sure.
start moving on to the other private.
Yeah,
types of
absolutely. Yeah.
operation.
So we will have more to say quite soon about when elective surgery can safely start again. That isn't today. It's not going to be next week in terms of when surgery can start. As soon as we can make announcements that we've got some certainty in, then we will. I just again reiterate, anyone who needs medical care, then you should come forward and get that care. GPs, hospitals are all going to extraordinary lengths to provide that care safely. No one should be putting off their care out of any sense of fear. There's a lot of work going on to try and provide people with everything they need in a timely way. Category 1 surgery still happens. They're the most urgent patients. Urgent Category 2, the most acute Category 2, they still happen. But yes, there are many, many thousands of people who would have had their surgery but have had it postponed. We'll have to catch up with them, and then we will need to lock in perhaps higher levels of activity month on month to make sure that we stay ahead. I think we can do that. It'll be a significant task, so to have, well, in effect, well, it's many months. It's many months where we've had some changes and therefore less surgery being done than would otherwise be the case. I'm confident that we can catch up. And as soon as we can have more to say about that, we will.
Did the Apollo Bay testing come up with any results, any positive cases?
Not that I'm aware of yet, but as soon as we can speak to that, or if there's something that's happened that I haven't been briefed on, we will come back to you.
The DHHS advice currently says that individuals visiting each other in their social bubble will have to wear masks inside each other's houses if they're doing that. That rule doesn't apply for people visiting their partners, even if their partners live in a household with other people. Are you discriminating against single people, I guess, yet again, because this is a rule that hasn't even applied to them until now?
Well, I wouldn't accept the conclusion you've drawn. These are measures that are absolutely for the benefit of single people. This is of public health advice, and it's the best accommodation that we can enter into, the best arrangement we can enter into to get some social connection for people who live on their own. I think it's troublesome to compare two people who are connecting for the purposes of, for social purposes, who are not intimate partners, for whom masks would really not work, with people who are intimate partners. So I don't know that the comparison is a fair one. These arrangements are the product of having listened to singles who've done it very tough. We acknowledge that. But given that the interaction would not require, it's not intimate, then a mask is something that I think is appropriate, and that's where the public health advice has come from.
They'll potentially be sitting around a dinner table, sharing a meal, though. Is it actually practical
Well, I think
to
if you
expect them to be wearing masks?
Well, I don't think that the public health advice expects you to wear a mask when you're eating. That's not. If there's, I'll tell you what.
I'll
tell you what, Rachel. If there's public health advice that says that, I'll follow that up. I don't think it does, but if it does, I'll follow it up. The very nature of a platonic relationship between two people who are coming together to spend time with each other, that's very different to intimate partners who, by virtue of the fact that they are intimate partners, their contact is of a different nature. But I can't quite believe I'm having to explain that. But I am, but I'm stopping there because I don't think that serves any greater purpose than, anyway, fine.
Mine's a G-rated question.
2020, it's full of surprises. Anyway, yes, Samaya, G-rated you say. Excellent.
Last week when we recorded 90 cases, Professor Sutton said that he believed the true figure was actually probably more than 100. With testing rates, obviously there's been widespread community transmission. There are cases that we're still not picking up in the community. With testing rates coming down, how much, or I guess, how widespread do you think community transmission is, and how much are we still not picking up?
Yeah, look,
Do
I
you
think
have
it's
advice
probably
about
best
that?
if we take that on notice and have maybe a longer discussion about that at a briefing in a few days' time. We'll get someone from Alan or Brett or someone to come back and maybe take you through that. Look, I think it's important though not to say, oh, there's cases there we're not picking up. No. The key point is not everyone. This is just logic. Not everyone who's symptomatic comes forward and gets tested. We need that. We need as many of those people to do that as we possibly can, and that's why the appeal. I know I do it, multiple times every day. Jerome's done it today. But the reason we, like a broken record, ask people to get tested is that in some ways there's nothing more important than that. Any symptoms at all, get tested, and get tested as soon as those symptoms begin, and that's a really powerful contribution that you can make.
Given that we've had widespread community transmission over the last few months, regional Victoria's 14-day average is, as Lundy said,
Very
about
close,
5.4. You're not considering moving to the third step. Is it because that you believe there are still a lot more cases in regional Victoria that are not being picked up by virtue of some people either not coming forward for testing or them being asymptomatic?
No. What I would say to you is Lundy asked me a question that was essentially wanting me to predict what was going to happen in a few days or weeks' time. And rather than saying anything that might give anybody in regional Victoria a sense of false hope about what the next step will be, I declined essentially as politely as I could to answer it. That should not be read to mean that there's something I know that you don't about, or I'm not telling you about mystery cases or any of that. Test rates at the WHO level, they're at the WHO level. We have confidence that we're finding what's there. But then, that Apollo Bay sewage result did, I think, that was a big surprise to people, to have a community with no cases, no positive test results, I should say, but to have the presence of the virus. And again, I think Professor Sutton spoke to some of the things that might have driven that. But that's just another example. Sewage testing at the levels we're doing now is not the same as it was months and months ago. So it's just another example of always trying to find, the best, most contemporary, all the tools you can find.
When Victoria hits low or no cases, will you still retain the current capacity of contact tracing, or will you scale it down?
Yeah, to the point that I made to Alex before, it's hard to know exactly what levels it'll be, but it'll certainly be more than we need on any given day. I think you would always want to have a sense that you had a surge workforce that you can flex up and put as many people onto a task as you need. That's being a bit conservative on those staff numbers is a good thing, I reckon, particularly given the nature of this second wave, the amount of community transmission, some of the challenges, and the fact that it is fundamentally different to the first wave. It's a good thing. So I can't. It's not that decision hasn't been made, but my preference, and therefore I think the outcome will be that we keep the team as big as we can, so that we can respond as effectively as possible. Any other issues of any rating? No? Very good, thank you. I will see you tomorrow.
The Premier is giving his daily update. We'll take you to that media conference now.